We're back with Dr. Bridget Christopher, a cardiologist with Cone Health Heart and Vascular, talking about how to take charge of your heart health. So what do you do if you do have the family history of heart issues?
It's a great question, and I think it's the taking ownership piece. So we talked a little bit on the last segment about making the lifestyle changes, knowing your numbers, and that's very important. But to take the next step, you have to talk to your doctor. And I think a lot of people are nervous and don't want to come in and say, well, I'm not having symptoms, but it's really important to talk to your doctor because there are some extra tests depending on what type of family history you have, what type of heart disease it was. There may be some screening tools and other things that we can do to try to get you more information so we can figure out what your individual risk is.
I think so often we just wait for the doctor to say, oh, you should have this test or you should have this test. So what kind of health screenings or tests should we be discussing with our healthcare provider when it comes to heart health?
I love this. So it's really about, there are different parts of the heart. I joke that my husband works in construction and I've stolen his terms. So I think about there being 4 construction systems of the heart. There's the electrical system, there's the pump, I call the valves in the heart, the doors and the windows. And then there's the plumbing, which are the vessels that supply the blood to feed the heart. And so all of those different things can have genetic components that can affect family history. And so it's sitting down with your doctor, taking a really close family history, not just to say, well, they had some type of heart disease, but what type, how old were they? And then we can use that information and go forward and say, okay, well, if we're worried about a valve issue, let's get an ultrasound of the heart. If we're worried about an electrical issue, we'll get an EKG. If we're worried about the plumbing, we may get something like a calcium score. So having that conversation and as much information as you can give to your doctor helps have the discussion about what the next best test might be.
All right, so many of us have a watch or have something, an app or some kind of wearable that tracks our heart health metrics. What should we know about them and their role in taking care of our heart?
So the first thing to know is that they are a tool. They should not rule your life. So we have a lot of people who come in and they are overwhelmed with the amount of information that they get from these wearable devices or apps or other things. So the first thing is, don't let your technology rule you. It's important and informative, but it's not the be all end all. So I really like these trackers for things like increasing activity, trying to get your steps up, trying to get your heart rate into a certain range, and you can put in all your little variables and it'll tell you, how many calories you burned. That motivational piece is really useful. The thing to be cautious about with them is that a lot of times they'll send alerts and not all of those are perfect. And so if you're nervous, if you're not sure what's happening, absolutely talk to your doctor. But there are some times where I've told people to take the smartwatch off because it just fuels sort of all this concern and anxiety, and it's not necessarily helping them. So there are some tools. People who have a history of irregular heart rhythms, some of these devices can now capture an EKG, which is more helpful than just a heart rate pattern. But you just have to be very cautious that you don't get overwhelmed and overloaded with the information that comes from these trackers.
Okay, we've done a lot of information in the last 7-8 minutes or so. If you missed any of this, if you think to yourself there's a family member or a friend that needs to hear what you just heard on this interview, it's going to be in the 2-year well-being section of our website. Thank you so much for your time and your expertise. Hey, right now we're going to jump into our forecast since we have a weather alert day.